Hi everyone, I'm Alex from NeuroSure, and today I want to talk about Rezon Halos medical head protection. Halos is designed for people who want credible head and brain protection in everyday life. That might include people who are at risk of falls, seizures, drop attacks, fainting, poor balance, or head impacts linked to neurological conditions. But one of the big challenges with traditional protective helmets is that they can feel medical, bulky, hot, uncomfortable, or difficult to wear in public. That is where Halos is different. It was designed to give people the option to protect their brain and head in a way that feels more comfortable, more discreet, and more suitable for everyday life. And most importantly, it does all this without sacrificing genuine safety credentials. So this is Rezon Halos. At first glance, it does not look like a traditional protective helmet. It's lightweight, flexible, low profile. You can wear it slightly above the ears or covering the ears, depending on comfort, fit, and the situation. It can be worn on its own like this, or for an even more discreet look, it can sit underneath other headwear. This matters because protective headwear only helps if someone is actually willing to wear it. If a product feels too clinical or uncomfortable, it may end up being left at home, in a bag or on a shelf. Halos was designed to make everyday brain protection easier to accept, easier to wear, and easier to build into daily life. But the key difference with Halos is that it is not just soft padding. Halos is CE and UKCA Category II PPE safety certified protective headwear. That means it has been assessed as personal protective equipment rather than simply being marketed as a comfort item or a lifestyle accessory. Halos is the only non-helmeted head-worn protection with both CE UKCA Category II PPE certification and a Virginia Tech 5-star safety rating. It's been independently tested by Virginia Tech Helmet Lab, which is the gold standard of independent testing bodies for head protection. Virginia Tech's helmet ratings are designed to help consumers identify which products reduce concussion risk in tested impact scenarios, and its peer-reviewed testing methodology measures both linear and rotational acceleration. That distinction is important because a lot of medical headgear focuses mainly on cushioning the point of impact. These products are commonly sold as medical helmets or seizure helmets, but they have often been designed only to pad the scalp against cuts and bruises. Halos is different. It has been designed to reduce the transmission of both linear forces and rotational forces in head impacts. And it does this using a 9-layered system that reduces force transmission. That matters because rotational forces are the primary driver of concussion and subconcussive brain injury. Halos has been designed for everyday life and for every person. It can be worn with glasses, hearing aids, and even cochlear implants. It can also be worn with any hairstyle, including ponytails and afros, and it can even be worn when sleeping, swimming, or bathing. Halos is also machine washable and comes with a wash and carry bag. Halos has been designed to fit into your life, not the other way around. Halos uses a silicone grip to help keep it secure on the head. This grip has been extensively tested to ensure the headband stays on, but there are also some additional elements that can be added where necessary to ensure the headband stays in place in drop attacks or seizures. For anyone who needs extra retention measures, there is an optional grip band and an optional chin strap that can be added. These are both removable, allowing your Halos to adapt to your situation. Halos is also designed to work across a wide range of users, from children to adults. Sizing starts from 3XS for infants and goes up to XXL, which can be suitable for larger head shapes and conditions such as hydrocephalus. That wider sizing range is part of the NeuroSure mission, giving everyone the option to protect their brain in everyday life. Halos may be worth considering for people who are at risk of head impacts in everyday life. That can include people living with epilepsy, autism, neurological conditions, balance difficulties, fainting episodes, fall risk, post-concussion vulnerability, or other situations where head protection has been recommended by a medical professional. It's not a replacement for medical care, seizure management, fall prevention, supervision, or clinical advice, but it can be a practical layer of protection for people who need something more credible than a soft hat, but less bulky and less medical looking than a traditional medical helmet. For families and caregivers who are looking for head protection, there are two competing needs: a need for a product to protect and a need for the product to be tolerated by the individual who has to wear it. After all, medical head protection can only work if it is being worn at the time of the incident. And that is where Halos is so important. It brings together discreet design, comfort, safety certification, and independent testing in one piece of protective headwear. So, if you or someone you care for is at risk of falls, seizures, drop attacks, or everyday head impacts, Rezon Halos may be a strong option to explore. It's designed to protect the brain and head, reduce impact forces, stay wearable in daily life, and give people more confidence without making them feel defined by their condition. You can find more information, sizing guidance, and support at NeuroSure.health. I'm Alex from NeuroSure, and thank you for watching.